one thing that some people may not know or may not have experienced yet with Healthmark is I was once a customer of Healthmark's, and I actually had Ralph Basile in my department with Stephen Kovac, and they're asking me for feedback about, they got this decontam gown they're working on, and they wanted to find out what, some of their customers might think about it or what they might need in this type of product. And that wasn't the only time they did that. Like, they really are trying to focus in on the real needs of sterile processing. And you got actual ownership coming in with their own vested interest and spending their own time and trying to get real-time feedback. And they just really care about the needs of sterile processing. And that was just one example, I think.
Without supplies, there's no surgery. Without products, there's no patient care. Welcome to Power Supply, the healthcare supply chain podcast focused on helping you navigate the intricacies of logistics, purchasing, contracting, and supplier relationships. Each episode, we speak with healthcare executives, supply chain leaders, and innovative entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the loading dock to strategic sourcing, from buyers to the C-suite and across the enterprise, we tackle the real-life issues impacting the healthcare supply chain. Whether you're tuning in for conversation or inspiration, we're glad you're here. You're just in time to hear it from the source and stock up on insight. So sit back and plug into Power Supply.
On this vendor spotlight, we are going to be speaking with Kevin Anderson, Clinical Education Specialist, and Ashlyn Basile, Director of Marketing with Healthmark Industries. And this is going to be a conversation, and it's something that's been in the works since the pandemic, where Healthmark Industries has had a project. It's actually been going on for a while. They're going to tell us the story today, but to bring more of the production here, either internally in the United States at their plants in Michigan, or by utilizing local suppliers so that there's a more resilient production for the supply chain of all kinds of personal protective equipment, which was a big spike for them, and all of the other reprocessing essentials that they deliver out there to the sterile processing frontline users that ultimately end up in the hands of the folks in the operating room. So we are releasing this not only to our Beyond Clean sterile processing listeners, but also our Power Supply chain professionals, because the topic is so interrelated to that partnership between sterile processing and supply chain to make sure that we're able to control costs and still deliver the highest quality care to our patients. And so stay with us. Great conversation for today. We're going to be right back with Ashlyn and Kevin after a short break.
A production of 17 Studios, you're listening to Power Supply.
We are speaking now with Kevin Anderson, Clinical Education Specialist, and Ashlyn Basile, Director of Marketing for Healthmark Industries. And this conversation today, I know we're speaking to two different audiences, the sterile processing professionals out there in Beyond Clean, but also the supply chain professionals with our Power Supply brand as well. And the conversation very much about some lessons learned over the last 3 years and some things that you are all doing at Healthmark in response to supply chain disruption and really bringing some continuity to the frontline technicians that are working out there in healthcare. And I will say the conversation will be talking a lot about reshoring. And this is a big move in healthcare supply chain. So I think the supply chain team will really understand this, and the sterile processing professionals will really appreciate that, what it means for them on their day-to-day. So first, I'm going to introduce somebody who has not been on the show before. Ashlyn, I want to welcome you to the Beyond Clean and Power Supply podcast. I want to thank you so much for coming on.
Thank you very much, Justin. I'm happy to be here.
So, Ashlyn, why don't you tell us a little bit about your role with HealthMark and maybe some of your past experiences and especially the challenges over the last 3 years that you've faced?
Yeah. So as you mentioned, my title is Director of Marketing. So that is working both with the traditional marketing team as well as overseeing the product management team. The product management team is actually something that I built out when I joined HealthMark corporate in June of 2020. So I came into this role right in the thick of COVID. So it's been a lot of learning as I've gone along. We were obviously doing product management activities, but there wasn't really a specific team to handle them. And it was some good timing to do so. But between COVID and every other supply chain issue that could come up, that we'll cover the rest of this podcast episode.
So, Kevin, you are not going to be a new voice, at least for the Beyond Clean audience for this spotlight. You've been on a number of these, as well as the educational podcast for Beyond Clean, but you are new to our supply chain audience. So if you could talk a little bit about your background as well, that would be great.
Yeah, absolutely. So I've been with HealthMark Industries now for about 3 years as a clinical education specialist. And basically anybody on our team that functions in the same role as me is here because we worked in the hospital. So formerly I was a sterile processing manager and endoscopy manager, but also an OR manager and OR nurse and tech and all of that good stuff. And for a number of my roles, I worked very closely with supply chain, and we did a lot of things and accomplished a lot of great things project wise that probably would have never happened had we not had a great working relationship with supply chain. So I'm really thankful that you actually have an audience in supply chain and that we can kind of bridge that gap between supply chain and sterile processing, because it is a very important relationship within the hospital and obviously with the manufacturer as well. So we have all the bases covered here on the podcast, which is great.
Yeah, it's funny. There are a number of executives and VPs in supply chain today that got their start in sterile processing as well. And there's a very close relationship between sterile processing and materials management. So I think even more than maybe some of the other departments that work closely with supply chain, there's a real kinship there and a close collaboration. And we really do like having a little less siloed conversation as much as possible. And the topic that we're going to be discussing today could not be a better opportunity to break out of those silos and have this discussion. And as we mentioned, it's really about reshoring and reinvigorating supply chain. But what I love about the title, you did a press release that kind of announced some of the things we're going to be discussing today, and you titled it Bringing It Home. And that makes me think of one of my most favorite Bob Dylan albums. And so bringing it all back home, but that's really what it's about, is so much of the supply chain disruption. If you even look at shipping containers and shipping canals getting clogged and all kinds of things that caused disruption before, being able to produce products here in the U.S. has become a major focus, and it's really about supply chain resiliency. So Ashlyn, I'm going to have you talk a little bit more about that, but first I want you to talk to the audience about HealthMark as a company. Can you just give a little bit of a background?
Yeah, absolutely. So HealthMark was founded in 1969, so a little bit over 50 years ago by my grandparents, actually, Suzanne and Ralph Basile. So they founded it in the basement of their house, and it's amazing to see how it's grown to where we're at today. But my grandfather was calling on hospitals as a sales rep previously, and during that time, he got to know some sterile processing professionals and realized that there was this need in the hospital for attention to be placed on the sterile processing departments and what the needs of that department was. So with that, HealthMark was founded and has grown to be what we are today, where we really focus on offering innovative medical supplies and solutions to our customers, especially in the sterile processing department. So we're always trying to launch new products and then also make sure that we are a reliable supplier to our customers. And so that's really what we're here to talk about today.
I just wanted to add to what Ashlyn said, because one thing that some people may not know or may not have experienced yet with HealthMark is that I was once a customer of Healthmark's, and I actually had Ralph Basile in my department with Stephen Kovac, and they're asking me for feedback about, oh, they got this decontam gown they're working on, and they wanted to find out what, some of their customers might think about it or what they might need in this type of product. And that wasn't the only time they did that. Like, they really are trying to focus in on the real needs of sterile processing. And you got actual ownership coming in with their own vested interest and spending their own time in trying to get real time feedback. And they just really care about the needs of sterile processing. And that was just one example, I think, that they've been doing for a very long time. But I just had an experience with that. And I think that it's really important to the background of this company.
Yeah, one of the things that I love is just how creatively Healthmark brought education to the market as well. And I love stories from companies that have a nice long legacy, Ashlyn, like you described. And you talked about actually PPE just now, Kevin, talking about innovating and designing PPE specifically around feedback from the people that have to use it every single day. And that is one of the biggest impactors over the last several years has been, managing PPE and honestly back orders and back order management from multiple different companies has been a real challenge. Can you dive a little bit deeper, especially through the lens of sterile processing as far as how different it has been and what it has had as an impact on the front lines over the last several years?
Yeah, for sure. It has been interesting to say the least. I know from obviously we want to look at the sterile processing side, but it kind of goes right along with Healthmark's side of the story too. But everyone was using so much PPE during the pandemic, just volumes of PPE. And of course, that created demand from suppliers that maybe hospitals weren't used to maybe getting PPE from, including Healthmark. Healthmark in some ways benefited from that in terms of, there were more people asking for PPE because their traditional distributors and manufacturers were having trouble providing supply for it, for the demand. It was not just PPE, but that was a huge part. You also had wrap and container locks that were also on short supply. And so we were being reached out to for things like that. So there were a lot of things going on, even just specifically in sterile processing regarding all these different products, which created demand for Healthmark, but then also a challenge for Healthmark to meet those demands. So it was just kind of going full circle with everybody and a serious challenge for everyone, honestly. Of course, the demand is nice, but it's hard when you can't meet it. And so that brings along, I think some of the challenges and things that Ashlyn got to deal with, and which I'm sure she's going to speak to from the manufacturer side.
Yeah. So, like Kevin said, we have this line of PPE that already SPDs were buying it from us. SPD professionals were using it, and we designed these products and sourced these products with those staff members in mind. But when COVID blew up and we had a global pandemic on our hands, it became a lot more than just sterile processing professionals who were using this PPE. So that was something that we didn't anticipate. So from Healthmark's side, we ended up having to, go on allocation at certain times. We could only let certain facilities buy a certain amount, things like that. So that's really difficult to have to tell customers no, especially in that time of need. So at the same time, trying to communicate with our suppliers and how we can grow our supply on hand as well. And there wasn't a good answer to a lot of it at that time, as many of us know. But the other thing that's kind of funny is where there was a growth in demand in areas that you wouldn't have anticipated. So for example, early on when there weren't any of the N95 masks available, we ended up having a ton of Tyvek pouch sales because this is when the facilities were ending up having to sterilize their N95 masks in the Tyvek pouches. And so that's something that we never could have anticipated. We try to have our finger on the pulse of what's happening in the market as much as possible. But first of all, no one expected, or I guess a majority of people did not expect a global pandemic to hit and didn't expect that N95 masks would not be available, and then did not in turn expect that Tyvek pouch demand would be off the rails. So just things like that. There was a lot that came up in 2020, especially when I was really brand new to the product management team. But luckily, there are a lot of other people at Healthmark who have been here for a long time, especially in inventory management, who helped us get through all of that. And it just made it even more clear how we need to have more control over our supply chain, do things ourselves as much as possible.
Yeah, Ashlyn, there was really just like a complete waterfall effect. I think you're right. Not only manufacturers not anticipating demand for some of these things, but also, supply chain not anticipating that, busy enough just tracking down PPE and chasing that and managing the back orders because of all the things that Kevin mentioned. But then also, all these other increased orders that they needed to be able to accommodate some of the alternative planning around substituting for the fact that there was a lack of PPE. And then, of course, there was hoarding. But a lot of it came down to the fact that it was a global crisis, and we didn't have a lot of control here stateside over the production of the products and the access to raw materials and things like that. And I think there's a lot of people who don't realize that many of the suppliers in the healthcare industry have their own suppliers and have to manage suppliers, that help them bring the products to the front lines. And so I really want to move to the part of the conversation, because this is a big announcement for Healthmark in terms of really trying to have a lot more control locally here in the United States over the products that are being manufactured and distributed out to healthcare. So can you start talking about what you've done to meet that need and address some of the lessons learned that, like you said, you were thrown into the fire and it was a major focus for you over the last 3 years?
Yeah, so we learned very quickly, like I said, that the best way to be is self-sufficient. And so over these past years, we have identified some product lines that especially needed to be brought in-house or be moved over to more reliable sources of supply. So yeah, the huge initiative has really been bringing a big part of the manufacturing process for our tray liners and soaker sheets in-house. So we put a lot of capital investment into having the machinery to create the end product that goes to our customers for use. So that has involved growing our staff, going through a lot of training on how to use this machinery, figuring out how to run the process most efficiently as well. So this has involved a lot of different teams. There's just the initial getting the correct equipment. And then after that, everything else comes, the training, putting all the processes in place. So it's been a huge undertaking, but this allows us, like I said, to be a much more reliable supplier to our customers. And so it's always really been a goal of Healthmark's to vertically integrate, but this was a major undertaking of one of our largest product lines that we did here. So
yeah, I think the disruption that we experienced expedited your plans, and you realized, okay, this was a priority, but now it's our number one priority, right? And so then I also want to commend the organization for spending the money to be able to do that, because times have definitely been tight in healthcare in general. And so then to go out, get that equipment, go through that process, and also, all of the quality management systems that have to be put into place. Can you talk about just the focus on quality as you've brought this in-house as well, and having control over the quality?
Yeah. So, the quality side is huge. We never want to have a product that isn't going to meet the needs and the expectations of our customers. So that was always at the forefront of this whole project, to make sure that these products are all at least meeting or exceeding the previous product. So this involved a lot of internal testing, some external testing as well. We ran some customer trials on the new product. We sent out for third-party lab testing on a lot of these products. So always the quality side was at the forefront, and we had a lot of procedures in place to make sure that we were hitting all of those key areas of quality.
We also spent some time going through and actually trying to use some of the product as it would be used in the facility. So probably not a lot of people realize, but HealthMark has their own sterilizer in their, in their R&D lab and things like that. So we would actually use these paper products in HealthMark just as you would in sterile processing and open them up after the fact and check them out and see that they're, from an end user standpoint, are performing to the same level as the products beforehand, before we changed and brought things in house, if that makes sense.
It does. And Kevin, you prior to your work in sterile processing had experience working as an OR nurse. So it's not just the products going in to sterile processing, but ultimately they're used and delivered to the operating room as well. So, and I know you have others on staff who have operating room experience. So I feel like that full life cycle from supplier acquisition coming into the department, SPD experience, OR experience, that's kind of all considered as part of this testing process you're describing?
Yeah, it matters. And what we're ending up doing is, actually I forget which team in HealthMark it is, but they're starting to want to run some of their own tests. And so now I've kind of helped the team develop their own checklist on what to look for from more of an end user standpoint rather than just, cause we have our own internal quality things. We subscribe and are certified by ISO. So we have our own quality management, right? But I'm giving them a checklist that is a more clinical type checklist to look at as well. So there's a lot of bases being hit in terms of.
That's one of the biggest fears of supply chain is that they source a product and then they see savings on it or there's a better value, whatever it is, but then they bring it to the clinicians and all of a sudden the negative feedback comes funneling in. And if you've ever tried to do a glove conversion in a hospital from a supply chain perspective, it is a huge challenge. And so, again, I think that's really important that not only do you have good manufacturing practices and you have quality management systems and ISO, I'm assuming 13485, because it's healthcare, you have all those things in place. But at the end of the day, if the clinicians and the frontline users don't want to use it, it becomes very difficult to take advantage of the value offering from any product that you might introduce through the supply chain. So it's one thing to test it internally and to make sure that, you've got some check boxes and how the end users are going to perceive it. But then eventually it goes out, it gets placed into the market, and you start to get feedback from those end users. And I know, Kevin, you're very well known in the sterile processing industry. You've got your own podcast, as a matter of fact, speaking to sterile processing. So I know you're very well connected. What kind of feedback have you received from the frontline end users since making this big shift with HealthMark?
Yeah, so far with this product line, Ashlyn talked about it being the primarily the paper product lines where tray liners and soaker sheets, which are really heavily used in sterile processing departments for almost every single tray. So it's getting used a lot. But yeah, so far the feedback has been great. I mean, it's kind of anticipated because like I said, I put my own, tests on these things and I expect things to work the right way. And it looked good at HealthMark when we were using it as is. Supposed to be used in sterile processing. And so far, to my knowledge, we've received very positive feedback. Some probably even think it's even better than the original product. And of course, that makes us very happy because Ashlyn, to my understanding, we're doing this at a very cost neutral, like it never changed the cost to the hospital, right? It's all been the same, correct?
Yeah, that's correct.
Yeah. So we've managed to keep the quality the same or better and kept the cost at the same.
I'd say even today, keeping the cost the same is a pretty big deal because of inflation, and most costs have been going up for healthcare. And I think that's really the crux that supply chain has been is on one hand, they want to be more resilient and they need to contain costs, and many hospitals operating on negative margins. And then on the other hand, the cost of goods has been going up at the same time. It's really put them in a very untenable situation. And so I'm frankly great to hear that too.
Yeah, I mean, I think that's a major part of being a reliable supplier. Besides just the fact that we can supply the product, that we have it on hand, I think the cost is obviously huge with what we've all seen hospitals are going through. So by vertically integrating, we're able to keep cost to customers as low as we possibly can.
So let's talk just, I know we're kind of getting close to the end here, but can they get samples? Is there, like, let's say one of your product lines, and maybe we should cover those real quick. Like, what are some of the categories? I know you've mentioned a few things like tray liners, et cetera, but can we run down the full list? Who wants to take that?
Yeah, I can take that. We've already talked about the tray liners and the soaker sheets, those sort of paper products. But in addition, there's a long list of other products too. So tip protectors went through this, tray corners, cable ties, tags and labels, products for bundling, packaging, and stringing. Tray covers, wash sleeves, protective packaging are the main ones that underwent. Not all are now brought in-house, but as much as possible, we've found domestic suppliers or suppliers that we are confident will be able to continue to supply us at a competitive cost and at the quality that we expect and our customers expect from us.
Excellent. Okay, so back to my question around the samples. Let's say that you've got a customer who's familiar with HealthMark, and I think most of them are out there, but they may not be purchasing all of these types of sterile processing essentials from you all. There are some in here. Can they request samples? How do they engage? Kevin, I think you even mentioned a rewards program to me at one time.
Yeah, actually, it's, I think people in the industry that have had the fortune of going to like a HSPA conference or an ISHM conference, as it was known before, they would get a lot of handout bags, not only from us, but from every vendor that they visited during the expo, and they'd give out free samples and all of that. Well, I think what's really important for people to know is you don't have to go to a conference or an expo to get free samples. We will provide free samples of pretty much anything that is a consumable type product. So all they have to do is reach out and request it, which we can provide information on how they can do that. But we also, as you mentioned, kind of teasing the rewards program, it is something that is kind of unique in our space. I think I've not seen one like it, not as a customer or on this side as a vendor. But if you're already using HealthMark as a supplier for your SPD, which we have so many products, I'd imagine you're probably doing some business with HealthMark. Well, then you're capable and eligible of getting a reward for that. And then you can turn those rewards into, we call them SP dollars, where you can actually purchase certification booklets like the CRCST textbook or CIS textbook, all those types of things. Or you can purchase a registration for someone to go to the HSPA conference or a more local chapter, whatever it is. But you can turn those rewards into either education textbooks or experiences, which is fantastic. It's actually something I highly recommend wherever I go, because I actually took advantage of it as a customer and purchased a lot of textbooks for people to get certified.
Yeah, what I love about that is, and we mentioned this at the beginning, how HealthMark has had not only a major focus on education, but also being very creative around it. And I feel like this rewards program is a really creative way to encourage career growth. And I'm finding more and more these days, there's less funds available to go to a conference like that or to pay for a certification. Meanwhile, many states are starting to require certification if you're going to work in the department. So what a great way to help out the hospital and continuing to maybe bring in people who aren't certified and get them certified within that time allotted period and utilizing those rewards programs for the materials that they need. This isn't the only way, though, that HealthMark provides free education. So can you round out sort of that discussion and tell, especially our sterile processing frontline folks, how they can get free CEs to continue their education and recertify?
For sure. Yeah. So one of the first things I noticed that was interesting with HealthMark when I was a customer was that they actually had these Crazy for Clean games that kind of just live on the website there. You can find it under the education tab. And it's just a different way to experience education and sterile processing, which is always nice to do something a little bit different. And so there is actually a new game out there called the Travel Instrument Guide. So I do recommend you go check that one out. But that's just one way. We also have webinars that live there now. So there's probably, I think at this point of the recording, I think there might be like 42 webinars just sitting there that you can take and get a CE credit for at any time. They're on demand. We also, as you mentioned, we have our own podcast called Ask the Educator, and we have a range of topics that we speak to on the podcast. That's available through any podcast channel, just like yours. And we also have a YouTube education channel, which we're trying to put more videos out there. We have videos that support products, but we also have videos that just address common questions in the industry. And all of that stuff is obviously free of charge. We don't want to charge anybody for quality education. This is something that we're trying to do just to support the industry.
What great alignment between the Beyond Clean brand and HealthMark. Like, complete value prop. We should not charge for education. We really want to all encourage frontline users, the people that are doing the job every single day, to be able to stay informed, stay educated, and not have it hit their wallet. And so we've always partnered really well that way. And I do want to just kind of point to some ways that they can connect. The people that are listening can connect with HealthMark, especially if they do want to get some free samples. You can call the toll-free number, 800-521-6224, or you can go on over to hmark.com is the website. Find them on LinkedIn, Facebook. They've got a great YouTube education channel. And of course, Kevin mentioned the Ask the Educator podcast, which is phenomenal. And I want to leave a little bit of moment here for some final thoughts. Ashlyn, we'll start with you as we wrap up. Anything that you want to add before we close?
No, I just appreciate you having us on today, Justin. Really excited to share with everyone the efforts that we've gone through to be the best partner to our customers that we can be. So thank you again.
And Kevin, how about you? Anything you want to add?
Yeah, just for anybody as in sterile processing side of the equation here, we always welcome feedback about products or any challenges that you might be facing. Even if it's not something to do with our product, we love to hear about it because we love to try and turn it into something where we can actually help you out in some form or fashion. And of course, if there's any way that we can better partner with supply chain users out there, we would love to hear about it.
All right, that was Kevin Anderson, Clinical Education Specialist, and Ashlyn Basile, Director of Marketing with HealthMark Industries. And really, this conversation today is to highlight some improvements that HealthMark has made to either bring production in-house or at least more local to the United States, as all of supply chain has looked to find ways to be more sustainable, more resilient post-pandemic. Can we say that yet? Post-pandemic? Certainly starting to feel that way. And also for the audience out there in supply chain, I'm not sure that you're aware of just how educationally minded and focused HealthMark is, which is fantastic. And obviously we learned a lot about their rewards program, but the different products that they have brought into this project to have more nearshoring or reshoring supplies that are going out to hospitals and healthcare organizations and systems include tray liners, tip protectors, tray corners, cable ties, tags, labels, bundling, packaging, and stringing, tray covers, wash sleeves, and protective packaging as well. So we heard a really great story today of a company with a long legacy, family legacy, and one focused on supporting sterile processing, but one that continues to also innovate. And they didn't raise their prices on these products as they bought equipment and hired and begin to develop the ability to produce them in-house or at least locally. I think that's a great story. So I do want to remind everybody, if you want more information or you want to request some samples, you can call 1-800-521-6224, or you can visit them at hmark.com. They're also on LinkedIn, Facebook, an excellent YouTube education channel, especially for you sterile processing team members out there. Kevin's podcast as well, Ask the Educator. He mentioned that he does that now with Adam Okada, formerly of Beyond Clean fame. And on the website, you can also find Crazy for Clean, which does bring some gamification to the learning environment as sterile processing professionals who are certified continue to look for free continuing education credits. That's going to do it for this vendor spotlight. I do want to thank everybody for tuning in today, and you can download the Beyond Clean smartphone app for iPhone or Android. It's absolutely the best way to listen to the podcast. For some episodes, we have bonus content available for download. So you just got to go to the episode, click on the gift box to find that there. And if you are already listening to podcasts and you haven't downloaded our smartphone app, you can certainly find us on Apple, Amazon, Google Podcasts, and just about any other podcast application. We love feedback as well. If you have suggestions for future guests or topics that you'd like to see covered on the Beyond Clean or Power Supply podcast, for Beyond Clean, you can send an email to info@beyondclean.net. And for Power Supply, you can send an email to info@powersupplymedia.net. Thank you for listening to this vendor spotlight on Beyond Clean and Power Supply.